Good evening, everybody, and welcome to another edition of the South Florida Tribune podcast. My name is Scott Morgan, off the Motor City Badmouth. And folks, let me give you a preview of what we're in for. Ever heard of COVID-19? A lot of people have, and I got news for you. We're going to have a very loaded broadcast tonight. And I am pleased to be joined by Evan Rosenberg, our South Florida Tribune legal analyst, and as usual, Gary Kornbluh. Before I get to them right now, I want to give you something, folks. As you listen to this show, I have some good advice. Get a pen and paper. You're going to learn an awful lot. We're going to bring you everything we've got. So with that said, Evan, welcome to the broadcast tonight. Glad to have you.
Scoop, thanks for having me. I appreciate it.
Oh, you're very welcome. And of course, Evan Rosenberg gets credit for calling Gary Kornbluh the Medicare Madmouth. And you know what? The Medicare Madmouth is what it is for this broadcast.
It's going to stick.
Okay, I guess I'll have to wear it, at least for this broadcast anyway.
Well, anyways, the South Florida Tribune podcast is presented by Senior Medical Associates. And obviously that's a company for which Gary Kornbluh represents. They've been a part of this promotion here. And as we lead you up to Medicare open enrollment, it's certainly our objective to provide some important health insurance shows along the way. And COVID-19 is arguably one of the hottest topics that we have going, and we're going to make sure we address it as objectively as we can and point out the necessary things that we need to do. So what I'm going to do is I'm going to go over a couple of things that are on my mind, and then we're going to start going to a little bit of a Q&A here. So first of all, the thing I often wonder about, folks, is the fact that you had the flu shot where there was a vaccination for the chicken pox and the measles, and yet it to me, it wasn't a big deal when you had those vaccinations. But now all of a sudden, COVID-19, we're asking people to get vaccinated, and all of a sudden, everybody's going every which way but loose. And I think that's a bunch of baloney. We'll get into that as the broadcast wears on. People are still dying that aren't vaccinated. So as much as I want to feel bad for these individuals, okay, it's pretty hard for me to be too sympathetic because with all due respect, okay, it's been out there for a while. By now, there's enough information, fear, and unfortunately, the numbers of casualties are so high that for those individuals that need to understand, folks, take COVID-19 seriously, okay? I think it's important to get vaccinated. So if I'm not as sympathetic because you're not doing it, I do apologize, because I'll tell you one thing. Earlier in the year, my Aunt Judy Stroll, who died at the age of 75, and unfortunately, her passing away, she was like an older sister to me. And unfortunately for my aunt, okay, she was in a rehab and in the hospitals and caught it in those places. And that woman had a lot of years to go. And when I lost her, if that wasn't the biggest humbling call for me to get vaccinated when they became available, then I don't know what it is. I bet you right now, folks, everybody out there has lost somebody important to this pandemic for sure. So, you know, I got to tell you another thing, that my sports coverage has been compromised with teleconferences like Zoom as well, WebEx, and I don't have the ability to go one-on-one with a lot of people. So we're forced to make the best out of a tough situation. And I just alluded to my Aunt Judy dying of COVID-19. To me, there wasn't a family member any closer than I have. And every broadcast I do, I know she's looking down on me, realizing I'm not here, but at least you can learn and educate your followers and your fans about what this is all about. And Judy, I love you very much and I miss you greatly. And you know what? This show's for you as well as everybody out there that are going through this unfortunate pandemic. Now, without getting politics too much, Gary Kornbluh has mentioned this in the past, and I know, Evan, you can certainly relate to it. Folks, we gotta follow the science, my goodness. And I have to admit that Donald Trump doesn't look that bad since this pandemic is going on. No president looks good if people don't follow the science. So, and one other note I should mention earlier, sports update, that the Jacksonville Jaguars players who weren't vaccinated, Coach Urban Meyer and General Manager Trent Baalke, they're higher risk individuals. And with the stringent protocols in the NFL, a lot of these guys got cut because of COVID-19. And don't be surprised for a lot of New England fans that as Cam Newton was cut today as well, I wouldn't be surprised if his lack of COVID-19 protocols affected it, because the last thing any league wants to deal with, and the NFL is going to be a part of it, is lose players to the pandemic, because then you have a prohibitive disadvantage because you don't have a full deck. I said my piece, okay, and that's where I'm at. So again, Evan, I want to welcome you to the show, and I'm glad to have you on, and we look forward to having you on more than one occasion.
Thanks, Scoop. I appreciate it. I'm looking forward to it.
Okay, with that said, Mr. Kornbluh, flash that one card that you have for Senior Medical Associates.
Thank you. Thank you, Scott.
Get the chance to do it today because we are loaded.
Okay, so thank you, Scott, and thank you for having me as well. I'm excited that Evan's on here with us. Let me just say that I just want to thank Senior Medical so much, because they sponsor my broadcasts, and they're just a wonderful group. They are a senior primary care facility, so keep that in mind. Those are for people that are 65 and older, and they are just wonderful. They take good care of my mom and dad, and I just love those folks. Their number is 954-659-9690, and just a great bunch of professionals. They have primary offices in Broward County, 10 of them, and just a wonderful group of people.
All right, so we're going to break this broadcast down into a couple segments. First, the medical side, then we're going to go defer to Evan on the legal side. So first of all, Gary, okay, the Medicare mad mouth, and yes, we're going to have fun talking about it a lot, okay. But at least he won't have to worry about trademarking it, because I don't think Senior Medical Associates would be caught dead trademarking it, but it's okay. We could still use it tonight, and it would get expensive. But with that said, Gary, what is the common belief as to how the coronavirus originated?
The common belief, wow, there are so many theories. We're pretty convinced that it came out of Wuhan, China, but it's really unclear. I mean, it seems like I mean, the most logical explanation is it was an experiment, a laboratory experiment done in a controlled laboratory setting that somehow went awry. I mean, it escaped from the lab. I mean, there are so many just ridiculous stories I've heard. I mean, I think it's entirely possible that maybe animals like bats could have been infected and possibly have infected the food supply. So that is definitely plausible, because during the Black Plague, they found that rats were carrying the virus. So it's definitely plausible that bats could carry the virus. But again, there's so many theories and so many ridiculous conspiracy theories. I mean, early on, it was said to just be a hoax. It was just like the cold, it was going to go away, and now we're learning now that it's really not a hoax at all. It's really quite serious. In fact, the second wave now, the Delta variant, is really so much more severe than the first in so many ways. But let me just say, it's just much more aggressive. Viruses are very smart. They learn. They pick up data from all of these people, these unvaccinated people that are walking around. They're basically like, petri dishes. They're giving these viruses the opportunity to grow, to mutate into much more dangerous viruses. And now we can see that just by looking at the numbers. And what's really alarming to me and quite disturbing, because I know it is to you guys too, because you have children too, but it's taking the lives of our young people, our children. And it's just so dangerous, because a lot of these children, I think children under 12 can't even get vaccinated. So we can't even really protect them with a vaccine yet. So it's our job to mask up and social distance for them. But I could go on and on, but I think I hope, did I answer your question?
I think you did fine.
Okay.
All right, so with that said, Gary, is this a preventable disease?
Okay, is it preventable? So let me just go back to the last one. So the question was, where did it originate? So we really don't know. We could say it originated in Wuhan, China. So that's pretty much what we know. As far as is it preventable, that's a great question, because it most certainly is preventable. It's preventable in so many different ways. it's preventable just by wearing a mask and preventing yourself from infecting the person next to you. It's preventable by staying away so that you're not sharing your, your sputum, your aerosolized sputum with somebody else that may be within 6 feet. It's preventable by being inoculated. It's very preventable. That's the real frustrating thing about this disease. And you said it well, Scott, in the beginning. You said, you get the chicken, you get a flu vaccine, right, every year. I mean, what's the difference between getting a flu vaccine and protecting yourself against the flu and getting a different vaccine? I mean, so it's just, it's frustrating because I think it's become politicized to a great degree. And it's really unfortunate because all we have to do is follow the science, but yet that's really difficult to do when you've got leaders and people in very powerful positions sort of dissuading people, or should I say almost, let me just say they're not encouraging people necessarily to mask up or to take the vaccine. So I think, unfortunately, it has become politicized to a great degree. But again, science doesn't lie, right? It's based on evidence, empirical evidence, right? It's based on, years and years of studies and clinical trials. I mean, before the FDA approves it, and after those years and years of studies, there are 3 clinical trials, phase 1, 2, and 3. So these drugs don't even get released or get approved by the FDA until they've gone through this very rigorous process. So I know a lot of people say, well, it's such a new vaccine and we're scared. Well, this is really not new. mRNA is not a new vaccine. The vector virus, which is offered by Johnson & Johnson, that is not new. All I can say is, folks, get out there and get the vaccine. It's no different than a flu shot. There's only one difference. The flu typically doesn't kill people, whereas the Delta virus will.
So getting back to my original question though, Gary, is it a preventable disease? Yes or no?
It is 100% preventable, definitely, with inoculation, with people getting the vaccine, getting both doses. If the vaccine requires 2 doses, the Johnson & Johnson requires only 1. But then there's a booster shot that will be FDA approved soon. Absolutely, I would recommend. I know that Evan's wife just got her booster, and that's such a smart thing to do because the 2 vaccines, let's say it's the mRNA vaccines, whether it's the mRNA or the vector, they only last for 8 months, and then you really need to boost your immunity back up with the booster, with that 3rd shot. I think, unfortunately, we may be faced with viruses, SARS type viruses for the next, 4 or 5 years before we really get this under control. I think science is progressing rapidly enough where I think they can get a hold of a lot of these conditions. There's gene editing going on right now, and I think there's some really new cutting edge biotechnology that can help us. But I think these dangerous viruses will be with us probably for the next 3 to 5 years.
Okay, well, let's segue over to Evan. Okay, Evan, in your estimation, do you feel that this is a preventable disease?
Absolutely. And Gary made some great points. I don't really remember the last time science and public health became political, and why it is political. This is a public health issue. This is not a politics issue. And unfortunately, politicians are using this as their platform. And it's really a shame. This is definitely something that is preventable. I saw a study recently that said that since more people have been wearing masks, the common flu has actually plummeted for the past couple of years. That's not a coincidence. That's not a coincidence. It's because people are wearing masks. People weren't wearing masks with the common flu before. Yeah, I mean, it's clear the data shows that the virus is spread through the air, through saliva, and very easily spread. And short of wearing gloves with the mask and a face shield, again, the mask helps. These are all things that are necessary in order to keep people safe and to get towards herd immunity.
Okay. All right. So let's move on to the next question. Do masks and social distancing really work? Gary?
Masks and social distancing have worked back to 2,000 years ago. I don't know I'm not really sure about which virus is the oldest one, but take the Black Plague, for example. Or in 1918, I think it was the Spanish flu. I mean, as far back as you can see photos, you can see people doing what? They're social distancing, they're staying apart from each other, and they're wearing what? They're wearing masks, they're wearing facial coverings. It's really just common sense. And here's the other thing. I get people that tell me, well, Gary, I got the vaccine. I don't have to wear a mask. Well, really, you do have to wear a mask, because it's wonderful that you got the vaccine. And it's absolutely critical that you get the vaccine to get to herd immunity. But the problem is you've protected yourself, and that's wonderful, but you haven't protected somebody else that may not even be inoculated, like a small child. And because you could easily be a carrier of the Delta variant, being a vaccinated person. So wearing that mask will prevent you from spreading that disease to somebody that's susceptible and that's vulnerable to the disease. So you could basically prevent from somebody else dying potentially. So yeah, I absolutely, face masks work. Social distancing works. Cleaning your hands with 60% plus alcohol-based hand solution, that works. When I go to the ATM and I touch the buttons, the first thing I do before I even put my credit card away is wash my hands with solution. These are good things to do. Thank God I haven't, I've been well. But absolutely. And then last and most important, the vaccine makes this disease preventable, right? If everyone got the vaccine, we would probably be at herd immunity now, and it would probably, this virus would probably be a non-issue. But unfortunately, as we all I seem to agree, it has been politicized. So people that really rely on the guidance of these very powerful people that may have discouraged them from wearing masks, maybe have discouraged them from taking the vaccine. That's the very unfortunate part. Because those are the people, unfortunately, right now that are dying in the hospitals that are on ventilators, because they chose not to get the vaccine.
So
they chose to make it political instead of following the science.
So reinforcing your point, as I am going to do right now, masks and social distancing, Gary, in your estimation, do really work.
Absolutely, yes.
All right, Evan.
Can I add something, Scott?
Yeah, by all means, go ahead. I want you to contribute to this.
So I think it also has to do with, without, again, getting political, I think it also has to do with how strict the states are in enforcing and establishing rules. People, I'm a huge believer and supporter in the Constitution. And people are, there are a number of people out there who are concerned that their rights are getting trampled on with regulations and executive orders to, either close businesses or to require masks. But the data shows those states that are requiring those or imposing those restrictions are the states with the lower infection and lower death rates. It's just common sense. I mean, the New York Times post a map regularly of what are the hot spots, and routinely Florida and Mississippi, I believe, and possibly Alabama and Texas are the states with the highest rate. Florida is ground zero. You know, the governor of Florida has taken a real hands-off approach, you know, to how people should handle the people should protect themselves. He's not going to impose any executive orders. He's not going to impose any restrictions. In fact, he's gone so far as to say, I am not allowing the individual municipalities to impose restrictions like forcing the citizens to wear masks. He went so far as to say, look, if any of the school districts are going to require masks, I'm not paying your school board. And it's again, this is going to the heart of why our state is a hotbed, and it really shouldn't be. You know, again, everybody loves their rights. Everybody loves, you know, their freedoms. But at the same time, whatever happened to love thy neighbor and, you know, my brother's keeper and all these fundamental things that we were taught growing up.
So yeah, I guess reiterating your point, Evan, you feel that mask and social distancing really does work, don't you?
At this point, other than mass social distancing and the vaccine, I don't think there's anything else that works.
Okay, that's a fair point. And I guess we have a majority here. I agree with you. The mask and social distancing aren't going away, whether we like it or not. Of the three of us, I've been probably in more public places than you guys as a result of what I do, covering sporting events and doing a lot of different things. And, you know, I definitely keep my distance. I wear my mask where I need to, unless I'm so far away from somebody where it doesn't make any difference. And I will tell you, the organizations that I've worked with the most over the last few years, last year or so, the Miami Marlins have been fantastic. The Florida Panthers have been fantastic. When I was covering some races up in Sebring, they were really fantastic. Jacksonville Jaguars. So those are just some of the places I've worked. And, you know, we had stringent protocols there, and the social distancing was there, and the masks were in place where you had to. So yeah, I don't think you can go wrong by wearing a mask and do social distancing. It's not going away anytime soon. Just because you have a vaccine doesn't mean you take the whole thing for granted. And I agree, I would love thy neighbor, but it don't look like too many people are loving thy neighbor, and thou is not using no common sense either. So Gary, this question's for you, okay? What are the long-term issues and side effects of coronavirus and COVID-19, and what is long COVID?
Okay, well, listen, I'm not a medical expert, okay, but I could tell you just from my own personal experience. I mean, I'm a career health insurance and Medicare agent, and many of my own customers are actually suffering from this new condition called long COVID. They called it, initially they were calling it long hauler's disease, and now the Wikipedia definition is actually long COVID. So you can see the Wikipedia definition, and when you read it, it is just horrible. And my customers tell me, and they're all complaining of these really horrible issues. I mean, more frequent lung infections and shortness of breath, even cognitive issues where they have sort of brain fog. Some really severe cases could be diabetes, onset of diabetes. We're hearing that more. You know, I know people that are experiencing inflammation of their limbs and weight gain as a result. It's just, you know, the anosmia, which is the loss of smell. You can have the loss of taste and smell, and sometimes that lingers, and that doesn't come back. So it's just, long COVID is just a horrible disease. And what I heard is that the government may at some point offer disability benefits for people that suffer from long COVID. So it's a real condition, and it's a serious condition. But again, I mean, it can be prevented just by taking the vaccine. You can prevent long COVID. And here's the problem. So what my customers have said is that, they survived COVID. They managed to get off the ventilator. They managed to get, out of the hospital and get home. What they're telling me is their battle has really just started now, because now they've got all these horrible symptoms now that they have to live with. And here's another point. Those folks have to actually pay up for health insurance more than the average person, because they need more comprehensive coverage. Maybe that a PPO might offer, and we know that those are more expensive plans. So it's costing you so much. It's costing you your health, your life, possibly. It's going to cost you money, and possibly really debilitating long-term effects from this long COVID.
So that what I'm gathering here then, folks, is this almost falls in the pre-existing condition category, doesn't it, Gary? Especially as you apply for health insurance. Yes. That's the read I'm getting it on this.
Yes, you're right, Scott. It is. It will be considered a pre-existing condition. Absolutely. Even a condition that may warrant state or federal disability payments. Now, that's not something that law is not in place now, but I read that they're considering that. That's how serious this condition is.
Gary, it's really about connecting the dots, okay? Long COVID equals pre-existing condition, and then TBD with the rest of it as this thing unfolds over the course of time.
Well, that's true, but here's the good thing. The good part is that even though it's a pre-existing condition, if you're under 65 and you're applying for health insurance, you really don't have to worry, because they're guaranteed issue plans. So that's the good part. You can't be turned down for coverage, okay? There are no pre-existing condition exclusions. Everybody gets a policy. Doesn't matter whether you're suffering from cancer or heart disease or COVID, God forbid. And that's the same for Medicare as well. There are some other additional rules regarding Medicare, but essentially, when you turn 65 and you're eligible for Medicare, it doesn't matter what condition you have, including long COVID. Fortunately, you are covered. But it has put a tremendous amount of pressure on the health insurance industry, and let's face it, it's caused a bottleneck in the supply chains. I mentioned this in another broadcast, but it's so true. I mean, I just went to buy out my lease because that was the best thing to do, because there's a chip shortage, so they can't produce new cars. COVID has really screwed up so many businesses, but most importantly, it's taken so many lives, so many that could have been prevented.
It's amazingly how you bring in the car analogy, because I'm in the process of trying to get another Jeep right now. And I'm actually going to be going back to Detroit to get mine, because I know people in the industry. But yeah, I've found that over the last couple of weeks, the chip shortage in automobiles, to me, has certainly been a thing that I'm dealing with. That's okay. I'm not worried about it. I always believe that as long as I got enough connections, it helps. But I can't say that for the average individual that doesn't have the luxury of going back to their hometown and going back to people that they know. But I see your point. All right, let's move on, Gary. And how do we get herd immunity, and how can we get the entire population vaccinated? Gary, you're going to talk about this, and then we're going to also have Evan involved in this as well. All right, go ahead, Gary.
Sure. My understanding about herd immunity is that it's at about 60%, somewhere between 60 and 65%. I think it's closer to 60%. So, which essentially means that once the entire 60% of the entire population is inoculated, then the virus will slowly, die off. That's the theory, right?
Right.
So that's herd immunity. Now, right now, as far as I know, we're at about 50%, or almost at 50%. So we've still got a way to go before we get to herd immunity. I don't know if we ever will. With this polarizing country. And again, Evan made such a great point about the states and how one state may mandate masks, another state doesn't. Everybody's got to be on the same page here. Maybe it should come down from the federal level, and, mandate that all of the states, take these precautions. Maybe at that point, maybe we could reach herd immunity somehow, but I'm just not all that optimistic because I see there are so many just anti-vaxxers out there that just, and again, I think they've been pumped full of these ridiculous conspiracy theories. It's one more ridiculous than the other. When really all they need to do is listen to the scientists and the epidemiologists. These people have gone to school for umpteen years. They're the smartest and brightest people that we have. And we just need to follow their guidance and the guidance from the CDC. And I think if we do that, if we can all come together and do that and leave politics at the door before you come in, just leave it outside the door. Okay. If we can manage to do that, I think we can manage to get to herd immunity at some point.
All right, then the other half of that question is how we can get the entire population vaccinated.
Well, I mean, we talked about this before. How what do you do? Do you bribe them? You give them $100. I think in Ohio, they're giving, a couple of $100 gift cards. Listen, I'll just say my brother's trying to bribe his daughter. He's got one child that just refuses to get the vaccine. He's ready to give her $1,000. I mean, where do you stop? What do we have to do to get these people to get this vaccine? I mean, they're literally seeing their friends and their relatives and their coworkers die around them. If that's not enough incentive to get that vaccine, I don't know what is.
Okay. All right, Evan, why don't you give me your take on the latter part of the question about what it takes to get the entire population vaccinated?
Sure. So, I'll really, all I can speak right now is to Florida. And Florida's approach thus far has been one of personal responsibility and individual accountability. The states left the individuals to make the decision for themselves what they want to do and how they want to treat themselves and how they want to prevent further spread. Unfortunately, this personal responsibility experiment is not going in the direction that we want it to go. If Florida is on this path of personal responsibility and deregulation, and we are now the ground zero, the hotbed of the United States when it comes to COVID, something is not working. All right, we need to do something. And the current track is not working. Whether that means imposing reasonable restrictions without violating an individual's constitutional rights, that may be what we need. Gary mentioned it before. Why should we need incentive? The incentive should be not to die. But at the end of the day, if people are not looking at that as an incentive, we got to start thinking outside the box. I mean, yeah, there are some states, I believe New York was one of them, that was offering, benefits to people who got the vaccine, whether it was a gift card or something. But you know what? States like New York and other northeastern states have the lowest COVID-19 rates, but they have the strictest regulations. I mean, for the longest time, I have family up in New York. For the longest time, there were restaurants that were closed. The streets of New York City were very quiet. But you know what? Their rates are nowhere near what Florida was going through, and the population of New York City is tremendous. So what we're doing right now in Florida, at least, is not working. The people aren't taking accountability. The personal responsibility experiment is just not working.
Well, I mean, accountability is really what it comes. I know earlier in the pandemic, New York had large numbers, but then when they got it under control, they started figuring it out, doing what they had to do, then their numbers drastically declined. And I think New York is one of the states that has done an outstanding job getting this thing under control because they have accepted accountability with that. And as I alluded to throughout the show, that losing my Aunt Judy to me, if that wasn't an incentive for me to get humbled or vaccinated, then I don't know what was. You don't lose the closest person in your life and not learn from it. But that's either here or there. What does it take somebody to lose a key loved one, and all of a sudden, well, maybe it is time for me to get that vaccine, even though we've had 9 million vaccines all over the place. But this one seems to take on a larger meaning for sure. All right, so let's go ahead. This is a question I want to ask both of you, and then Evan, it'll be up to you to go ahead and give us a legal perspective. Okay, does former President Donald Trump deserve a mulligan for COVID-19? I know at the beginning he accepted a lot of criticism because he didn't take it seriously, but all of a sudden you have a change of leadership, and I personally would give him a mulligan for it because the pandemic continues to be a problematic. It really, really does. So, I'm not going to tell you that he's exempt from a lot of his tweeting and other things like that, that probably got him in a little bit of trouble with the rest of us. But COVID-19 related, I think that former President Donald Trump does deserve a mulligan in this particular situation. Evan, your thoughts?
I don't know if I would go so far as say a mulligan. I mean, the one thing I really appreciated about Donald Trump's while he was in office was Operation Warp Speed. I think that was something that he really should get credit for, and it's worked out well. Unfortunately, it seems to me that his base, even though he was the one who kind of put the Operation Warp Speed into the works in order to get these vaccines out further, his base is still against getting these vaccines. So it's kind of counterproductive. And then again, going back to what I said earlier is I don't think he deserves a mulligan to the extent that he left it up to the states to decide what they want to do.
All right.
And you could see clearly there is such differentiation in terms of what states are seeing, are hit with hotspots, and which ones are actually have the virus under control. When you leave up to the states, you're going to get these disproportionate numbers. That's why if we're going to have something uniform, the federal government needs to step in, and they need to start making, need to take responsibility and step up and impose reasonable constitutional regulations.
Yeah, the only reason I mentioned giving him a mulligan is only to the extent, folks, that you have a new president in office right now. The pandemic hasn't gone away. So whether it's Donald Trump, President Biden, or whoever, the pandemic hasn't gone away. The numbers are still relatively high. We're losing a lot of people. So I won't totally blame him for all of it. But yeah, Evan, you're 100% right. It really comes down to the states and the governments to enforce it. And a president can do what he can do. But I see, again, this is why I'm not dwelling on it. I'm only making mention of it that I can understand where, regardless of who you have in office, COVID-19 is very much out there, and it's a very ugly situation with the past president and the current one, and that's as far as I'll go. Gary,
right, and just to add to that is, even if the president were to impose some sort of executive order regulation, it also is going to come down to the states following it. You could have certain governors that say, look, Mr. President, thanks for your executive order, but I'm not going to require my citizens to do that.
Right.
And and that's the sad part about it. There's not going to be any uniformity.
So then, with that said, do you feel, Evan, that's the government, if they don't enforce it, could take away funding? I'm going to get to your questions in a moment, but you bring out a very interesting point where you're going to do it one way or the other, or does it even get to that point? Because usually money is tied to a lot of situations, and usually money, when money talks, well, the end result.
It's interesting. I am following closely the governor's threat to the school boards of the counties that are imposing mask mandates. He said that he was going to withhold funding and the pay of the school boards that impose such regulation. And you know what? The school boards are still going forward, saying we're still going to do it anyway. Take away our paycheck. Our kids are more important, and you got to commend them for that. They clearly have the kids' best interest and the teachers' best interest at heart. So he's going to try to roll with the pen, but at the end of the day, you got to give it up to the school boards that are saying, hey, we're going to do what's right.
Fair enough. All right, Gary, what's your take on this whole thing about whether
Well,
President Trump deserves a mulligan on this?
yeah, thank you, Scott. I agree with Evan to a certain degree. I think he gets a certain amount of credit for warp speed. He definitely does, because he's the one that initiated that program. So I definitely give him a certain amount of credit. The problem is, as Evan had mentioned, his message was always to discourage mask wearing, to discourage social distancing, and even to discourage the vaccines. To this day, nobody even knows if he got the vaccine, but I'm sure he and his wife did. So he does get a small amount of credit, but I think he's taken all of that credit away by sort of polarizing his base to essentially be against science. I mean, and against these very critical things like the social distancing, the mask wearing, the hand washing. I mean, he almost discouraged people from doing that. And that's just, here's the problem. Evan mentioned about civil liberties, and I'm like the next guy. I enjoy my freedoms too and my civil liberties. I think that's so important. But at what point do you force people if people aren't going to take the initiative to protect themselves, and now they're going to potentially harm others? That's where it becomes a bit sticky. There's a liability issue at some point. Now, I won't opine on that, but I'll just say I will give Trump a little bit of credit, but I think for the warp speed, I think he took all of that away with his absolutely horrible and very negative messaging. Think about it. He was, and listen, I'm not going to tell you whether I'm a Democrat or a Republican. I'm just stating a fact. When you're shouting from the podium about this horrible, Hong Kong flu or, Chinese virus, I mean, I think he incited a lot of anger in a lot of people. And that's why it's so important to have good messaging coming from the top.
Yeah,
I think he took all that credit away from himself, unfortunately.
Yeah, you know what, Gary, you make some very valid points that the negativity may overshadow some of the other things. And it's all about how the message is delivered. If you're resistant, you're rebellious, and you're negative, then unfortunately certain things get overshadowed. So I can see that both of you guys make some very valid points, and that's why we're addressing this head on. With that said, okay, Evan, we're going to talk about the legal aspect of everything. And I'll lead off with this. Can your employer require you to get the vaccine?
Good question. Yes, absolutely. Florida is an at-will state. So if an employer makes a mandate that you need to get the vaccine and you choose not to, unless there's some sort of strongly held religious belief or a good medical excuse, your employer can certainly let you go if you don't get the vaccine.
Yet, ironically, as we talk about it, here we are talking about the Jacksonville Jaguars at the beginning of the broadcast, letting some players go because they weren't vaccinated. And again, you could see that around. But the fact that we're talking about Florida and how it all came down with the Jaguars when they made their final roster cuts, that factored into it, it further validates what you were talking about. Gary, do you want to chime in on this, or you want to wait till the end and choose the ones you want to comment on?
No, I mean, Evan's the legal expert. If you want my opinion, I agree. I think every company should mandate that their employees, if you're going to come into the office and you're going to be exposed to other people, other coworkers, then I absolutely think you should be vaccinated. You would be horribly inconsiderate, to say the least, if you entered into your workplace and you weren't vaccinated. So yeah, I think every company should be mandating this, and they're starting to. You can see that happening.
And, Gary makes a good point. Employers have an obligation to keep their employees safe. And to that extent, if they want to mandate the vaccine, they're well within their right to do so. I mean, again, because the burden a lot of the times is on the employer to make sure that their employees are safe.
Well, it goes back to what you said earlier, Evan, love thy neighbor. And in a lot of places where you have the test pretty close by, your neighbor is within a matter of a few feet. So yeah, I can certainly appreciate the fact that they should require the vaccine. Then again, I'm always going to require that because I'm vaccinated anyways. And when the booster shot does become available, yes, I will be getting that too. On to the next question. Evan, is your company liable if you are required?
If you're required to get a vaccine, is your company liable for, if you get sick?
If required, yeah, if you get the vaccine, it gets you sick.
So the vaccine gets you sick. No, the company's not going to be liable because, again, going back to what I said earlier, Florida's an at-will state, and an employer isn't necessarily forcing you to get the vaccine, only making it a requirement. So you have the choice not to get the vaccine, but the employer also has the choice not to keep you around. So, again, you can't, because it's a choice, the employer cannot be held liable.
Okay. Can my landlord require me to show proof of COVID vaccine?
So that's an interesting question. If you're in the middle of a lease, assuming that you're paying your rent and doing what you're supposed to do, and your lease is not up, you can't create an obligation that isn't in the lease. And most leases, if not all of them, probably don't have any, didn't anticipate the COVID situation. But when the lease ends, it's certainly within the right of the landlord to say, hey, look, I'm going to put a provision in there and say, I want proof, or I want you to get, show me proof that you're vaccinated in order to rent my property. So yeah, absolutely.
Okay, can my boss require me to get tested weekly if I don't get the vaccine, and can the boss make me pay for it?
Absolutely. Going back to what I said earlier, an employer has an obligation to keep the workplace safe, and testing is legally reasonable. It's reasonable to impose on an employee. So I think that I think an employer could certainly do that.
Okay. If I'm a customer of a store, can a business require me to show proof of COVID vaccine?
So there's actually a new law out that says that customers of a business don't need to show a card or proof of their vaccine. There was actually a new law that was passed by the legislature. This is kind of a gray area because I think there's going to be certain legal challenges to this, and I do expect this statute to get struck down. But as of right now, the new law says that customers of a business don't need to show their proof.
Okay, and finally, Evan, have you seen any lawsuits or laws enacted related to COVID-19 liability, also known as the COVID-19 Liability Protection Act?
Yes, the COVID-19 Liability Protection Act was recently passed. There are a number of restrictions, and essentially they've made it hard for someone to sue for COVID-19 related issues. For example, if you wanted to bring a lawsuit that's COVID-19 related, one of the requirements that the legislature posed was that the plaintiff would need to get an affidavit from a physician who's actively licensed that says that within a reasonable degree of medical certainty that the damages or injuries were caused by the defendant's acts or omissions. So that's going to be a prerequisite to filing a lawsuit. In addition to that, they've also shortened the statute of limitations to bring a lawsuit. So normally in a negligence claim, you need to bring your negligence action within 4 years. And they've actually knocked it down. Plaintiffs will have 1 year now from the date the action accrues to file their action for damages. And also there's, in a normal civil suit, lawsuits are determined based upon a preponderance of the evidence in civil action, which means that in order to prevail in a civil case, you just need to show 51%. You know, the scales of justice. You see the lady justice holding up the scales, and in order to prevail on a civil case, you just have to kind of tip the scales just slightly more than the other side. So we say 51%. But for COVID-19 related cases, the standard is no longer a preponderance of the evidence, it's clear and convincing evidence, which is, there's really no number attached to it, but it's significantly more than what a preponderance of the evidence would be. So those are some of the main changes to COVID-19 liability lawsuits.
Well, all I can tell you, folks, I hope you've learned a lot from this show, because I'll tell you what, we've given you the medical perspective that Gary Kornbluh delivered. Evan's first act was an outstanding act, talking about the legal side of the whole thing. So Evan, when you put things in perspective, what do you want people to get the most when they have the opportunity to listen and watch this broadcast?
You know, it's going to be hard. You know, I don't think we're going to be able to change people's minds when it comes to, because politics has already inundated itself with this issue. So, and nowadays, you know, people are so easily inflamed by any talk of politics. While this really is a public health issue, not a political issue. Once it's made a political issue, people are going to you know, start taking it to heart and start you know, taking it personal. And unfortunately, all we can do is just try to just love thy neighbor. Try to, you know, and spread the love and spread the science and the knowledge and the support that's behind all of this. You know, really, it comes down to personal accountability, like we mentioned before. Unless the person is going to take personal accountability, we're not going to see any change. Or if there's any sort of regulation, we're not going to see any change.
Okay, Medicare, Mad Mouth, go ahead and chime in. What do you want people to take from this broadcast?
Well, just, you know, it's a lot of information. It's a lot of controversial. It's a very controversial subject. Let's face it. Just as Evan said, as Scott said, as I'm saying, just look at the science. Just follow the science. It's based on evidence, much evidence. It's factual. We can see that the majority of the people that are on ventilators in these hospitals in this country are the ones that never got vaccinated. If you speak to every one of these people while they're on their deathbed, they'll tell you that they've had a sudden change of heart, and they're literally begging the doctor if they can get the vaccine. And unfortunately, the answer is, we all know that the answer, sorry, it's too late. So don't get that kind of response from your doctor. You don't want to ever hear those words, sorry, it's too late. So get the vaccine and protect yourself. I told my niece and nephew the way I explained it to them and had them get their shots, and they were so afraid to get these shots. I said, look, your first shot's going to be your first coat of armor. It's going to give you half of the armor that you need to fight this battle. The second shot's going to give you that full coat of armor. I mean, how else, you know, I explained this to my 15 and 16-year-old niece and nephew, and they got it. I mean, if we need to explain that to the public so they feel better, you know, go out and get your coat of armor, folks, and protect yourself, and wear your mask and social distance, and wash your hands after you've touched something where maybe the public has touched. Do this, and you can save yourself and your family a lot of potential grief, and you'll keep yourself healthy.
All right, well, just, you know, folks, South Florida Tribune Podcast is presented by Senior Medical Associates. My name is Scott Morgan, Rough Motor City Mad Mouth. Glad to be joined by Gary Kornbluh, tonight's Medicare Mad Mouth, and the guy that gave him the name is Evan Rosenberg, who will definitely be seeing
Thanks,
a lot
Evan.
time on the network as well. Well, my final thoughts on the whole thing is, yes, Gary, you alluded to it, follow the science. You know, it's, you know, whether you don't want to see a loved one that's you miss so dearly succumb to it, let alone have to go through it yourself too, because a lot of people are losing their livelihood because they can't work, and they're losing their ability to see their kids and family members. And it's just a shame, but you don't want to lose a family member. You don't want to get extremely sick yourself. And yeah, the love thy neighbor part does come into play. So folks, get the vaccine. My goodness. I mean, because to me, we don't want to be the ones that dictate our own fate for all the wrong reasons. So I want to say that I'm not sympathetic to those individuals that didn't get it. Well, I don't want to say that, but there's perception, and the reality is that, if you had taken preventative measures in the first place, then you wouldn't be in the precarious position that you're in. So what else can I say? I know that if you have an opportunity to listen to this broadcast or watch it, by all means, watch it a few times. And Evan, why don't you let everybody know how they can get a hold of you, all right?
Sure. So I'm with the law offices of Ritter-Chusid. We're located in Coral Springs, Florida. We are a full service law firm. So if you have any legal needs, contact our office, 954-340-2200.
All right, Gary, go ahead.
And let me say that I use Evan and his law firm, and they were excellent. So I'm a customer. I'm one of his satisfied, happy customers.
Thanks, Gary.
So that's about it.
Now he gave you a nickname that you'll never hear the end of from my standpoint.
That's
right.
Yeah.
Go ahead, Gary.
Thanks for that. Motor City Madmouth sounds so much better than Medicare Madmouth.
No, that's all right. For tonight's show, it's appropriate. But all right, Gary, let people know how they get a hold of you.
So the best way to reach me is my cell phone. It's always on 24/7. And that's area code 561-305-5949. Again, that's 561-305-5949. And then you can always go onto my website, www.medigapx.com. That's MEDIGAPX.com. You can click on my testimonials tab, see all my 5-star reviews, all my wonderful customers, and they've said such nice things about me. And I thank them so very much for that. And then I thank Senior Medical for helping me and supporting me and sponsoring my broadcast. So thank you so much, Mohammed at Senior Medical.
All right, and to wrap it up here, my name is Scott Morganroth, CEO and publisher of South Florida Tribune. Our website's www.southfloridatribune.com. Our YouTube channel is South Florida Tribune. By all means, we encourage you to subscribe to it for free, and you can get all the broadcasts that we're producing. And you can follow us on Twitter at Tribune South. So guys, I know we've had a very tough subject to talk about, but you can't by any means dodge a subject like this, especially when there's so many lives affected. Not only the long-term health issues that folks are going to take, but the unfortunate people that have passed away as a result. So I'm glad we've been able to tackle this subject head on, and I couldn't be more happier than to have two great co-hosts tonight in Evan Rosenberg and Gary Kornbluh. We do it all the time, and what can I tell you? You guys were fantastic tonight. No ifs, ands, or buts about it. And I enjoy working with you guys, during our networking group that appears 3 Tuesdays a month. So on behalf of Evan Rosenberg and Gary Kornbluh, my name is Scott Morganroth, the Motor City Madmouth. Thank you for joining us on this edition of the South Florida Tribune podcast presented by Senior Medical Associates. And as I said before, and I'll say it again, get your notepad and paper, take a lot of notes because there's a lot of good information here. So good night, everybody, and we'll catch you on the next edition of the South Florida Tribune podcast. Everybody be safe out there. And once again, folks, get vaccinated. Good night, everybody.
Good night.